All right.
Hi, everyone. We will be starting in a few minutes. We're just waiting for people to join. Thank you for coming, though.
And you're welcome to put a note in chat and say where you're calling from.
Yeah, that would be
That's
great.
It's a lovely idea.
Yeah. Wow, Greenville. Wow, Indiana.
Okay, I have 8 o'clock my time. Shall we go ahead and start?
That sounds like a plan.
Okay.
Okay. Well, I think it's up to me to introduce the session. Welcome to everyone. My name's Helen Mandel, and I'm the Deputy Secretary General at IFLA. And I'd like to welcome you from wherever you are in the world. On behalf of IFLA, I'm really pleased to be part of this event because it's an important day. World Evidence-Based Healthcare Day, today, the 20th of October. And why do I think this is important? It's not just a general World Health Day, but one dedicated to evidence-based healthcare. And this is the crucial part of it. It's also part of a 2021 campaign on the role of evidence in an infodemic. saying that the need for scientists, researchers, policymakers, clinicians, and information brokers to work together has never been greater. And who are the knowledge brokers? Of course, they're librarians, and there's no one better placed to do that. The librarians are the people with connections to all kinds of communities, and it's a profession that has enormous trust in its communities, and that can't be underestimated. We have a critical role to play in bringing information to societies so that they can make themselves informed decisions about their own health. This session is going to explore how libraries are catalysts for community engagement in this area. And this ties in very neatly with IFLA's own vision of a strong library field powering informed and participative societies. Our global vision discussion a few years ago really called out how libraries had to become more active and transform their roles and remit. And at no time has this been more evident than in the last 2 years and since the beginning of the pandemic. Libraries shared willingly thousands of ways in which they were changing services and providing evidence-based information and other kinds of assistance to communities. So I think what is trying to happen with the day, what's trying to happen with this webinar, and the general forward movement of IFLA all align so neatly together. So in all of the work that we've been doing through the pandemic, the Evidence for Global and Disaster Health Special Interest Group of IFLA has been right there in the mix. And it's great to see them take this day and use this day as a means of taking the agenda another step forward. So I'd just like to say my congratulations to the committee and to the Health and Biosciences section for the organisation of this event. I think it's going to really be fascinating. But I'll stop there and introduce the two speakers today. Our first speaker is Feili Tu-Keefner, PhD, and she's an associate professor in the School of Information Science at the University of South Carolina. She's also one of the founding committee members and a current academic advisor of the Certificate of Graduate Study in Health Communication program, one that's jointly administered by the Arnold School of Public Health and the College of Information Communications at the University of South Carolina. She's co-authored a book, Health Librarianship: An Introduction, and has authored a number of journal articles, conference papers, and book chapters, mostly in subject areas related to information and library science, health information studies, and public health. And she's been a member of the IFLA Evidence for Global Disaster and Disaster Health Special Interest Group since it started in 2018. Our second speaker is Caroline De Brún. She's a knowledge and evidence specialist in public health since 2014 and a medical librarian since 1999. So a lot of experience there to bring to today's webinar. She's co-authored a chapter on searching for reports of existing research for the World Health Organization reference book. And this was about methods to guide health emergency and disaster risk management. And she's also proud to be a member of the Evidence for Global and Disaster Health Special Interest Group. So I think we're going to hear from two very experienced speakers who will call on a lot of what they've also seen and learned over the past year and a half or more. So with that, I'll ask you to enjoy the webinar today. We'll be interested, I think, in questions, but I'll hand over to our organizer, Bethany, for some housekeeping announcements.
Thank you, Helen, for that wonderful introduction, and welcome everyone. Before I turn things over to the speakers, I just want to make a few housekeeping notes. First, you can type any questions that you have into the Q&A box. So please distinguish between the chat box and the Q&A box. The icon for the Q&A section is going to be at the bottom of your page, and we'll leave about 10 minutes at the end of our presentation to address any questions. So please do use that function. Share any comments that you have in the chat box. Also, we do ask that you feel free to tweet about the webinar. I'm going to put some of the hashtags or handles into the chat box. So the handle for World Evidence-Based Healthcare Day, for IFLA HBS, and for our E4GDH SIG are in the chat box. And then finally, I just want you all to know that the recording of this webinar will be available along with the PowerPoint slides after the webinar. That said, I will turn things over to.
Well, Bethany seems to have some technical difficulties. Okay, so we will get it started. Ms. Mendel, thank you very much for your wonderful introduction. Greetings to everyone who joined us virtually. So we will get started to our presentation. An unknown acute SARS virus was first reported in December 2019, after which COVID-19 rapidly hit country by country worldwide. The World Health Organization declared COVID-19 a pandemic on March 11, 2020. Since then, global health professionals, public health professionals, and information professionals have fought against these rapidly evolving virus and its variants and an infodemic. I believe that librarians are first responders to people's needs. Situations vary, but they stand tall when their users, their community members need their support, especially in times of crisis. Today, Caroline and I will present evidence from several research projects relating to our work affiliated with IFLA Evidence for Global and Disaster Health Special Interest Group. We would like to showcase information professionals' leadership qualification and their contributions in the fight against the both pandemic and the infodemic. I will begin by talking about the evidence that I found from the situation-specific studies examining disaster information, dissemination, and services provided by librarian first responders in public libraries in times of crisis. My discussion will focus on the librarian's leadership qualifications and how public libraries provide essential services to community they serve in times of crisis. Then Caroline will present evidence on how health information professionals have been taking leadership role in supporting health-related communities during this pandemic. Please see an outline of our presentation. So I wanted to show you the geographic locations of the 3 studies my team have conducted. Since 2015, 3 situation-specific study examining the disaster information dissemination and the services provided by public libraries have been conducted by my teams. Our goal is to shed some light on the value of librarian first responders as they serve communities equitably in times of crisis. In 2015, several counties in the central part of South Carolina experienced catastrophic floodings that caused severe damage, including loss of homes and other destruction. In 2016, Hurricane Matthew hit the coastal area of South Carolina, causing both wind and water damage. And again, it caused the losses in the community. Then Hurricane Harvey hit Texas. It started on October 25, 2017, and went through September 1st, 2017. Hurricane Harvey hit Houston, Texas severely. We documented the public libraries' value to their communities and their legitimacies as partner of multi-level agencies from different sectors. Our intention was to examine and document the dynamic phenomena related to libraries and their social responsibilities in times of disaster. We use 2 frameworks from business management to guide our discussion regarding the leadership qualification demonstrated by information professionals in times of crisis. These 2 frameworks have been widely used to examine crisis leadership in different sectors. The evidence our team identified highlight a combination of the core tasks the librarian leaders performs in times of crisis and the emotional intelligence librarian leaders demonstrate to support the provision of community-first information services and facilitate the building of community capacity and resources for emergency response and recovery. As I am the primary investigator of 3 studies. The research protocol was based on a framework recommended by public health experts for effective health risk communication, preparedness, and implementation. Since I have worked with public health professionals and educators for numbers of years, I saw that many of them had not realized that public libraries have always been closely connected with diverse populations in their communities. Therefore, it seems beneficial to use a framework they accept to carry out these research studies. As I mentioned, in October 2015, several South Carolina counties experienced catastrophic flooding. In the immediate aftermath of the flooding, 3 focus group meetings were held. 25 library administrators and librarians were invited to participate. A pool of potential participants was identified based on their involvement in the library operations during and after the disaster, after which we formally invited them to participate in the study. In 2016, we worked with our research partners and the participants to identify U.S. Federal Emergency Management Agency, FEMA agents who were stationed in the public libraries in the affected areas. The site manager in South Carolina was granted the permission to meet with us for an in-depth interview to seek his views about collaborations with public libraries. In 2017, we conducted a survey on community members' use of disaster information sources and evaluation of information's credibility during and after the 2015 flooding and the 2016 Hurricane Matthew. This is a follow-up study of our research in 2015. Our third study targeted the Houston Public Library System's main library and its branches affected by Hurricane Harvey in 2017. Our team held 5 focus group meetings in Houston Public Library's main libraries, and we talked to over 50 participants. I now wanted to share some of our findings with you. Public libraries have a long history of community engagements in times of crisis. An example is the help of various sorts, including making claims to FEMA that librarians provided to people affected by Hurricane Katrina in 2005. On this slide, you can see quotes showing the information professionals' self-initiatives in times of crisis. These leadership qualifications are found in all 3 of the studies. We learned that critical information services make a big difference to community members during and after emergency and disasters. Information professionals, volunteered to work from home when libraries were closed due to damage from disasters. Librarian first responders put the community they serve above their personal needs. I feel very emotional when I analyze data collected. These quotes highlight how information professionals step in leadership roles in serving their communities and their institutions. It was very touching to hear a participant at the focus meeting said that she was willing to risk navigating difficult traffic to work in different locations one by one after Hurricane Harvey hit Houston so severely. Librarian first responders visited a variety of locations, excuse me, to help community members and stand by their side. However, these sacrifices may take a toll on information professionals' mental health. In contrast, society has been paying much attention to health professionals' mental health issues. Shall we not also recognize librarian first responders' mental health issues and welfare? Caroline will provide more discussion in the second part of this presentation. Much research has found that libraries play a critical role during disasters and emergencies. More and more public health professionals have recognized that public libraries have the potential to intervene effectively in delivering health information services to the public. According to our study results, community members strikingly show how much they value the librarian's information services in times of crisis. Public libraries are essential in community engagement at the times of difficulties. Librarian first responders are willing to go everywhere, including shelters, to provide critical information services. Another example is that during the pandemic, several public libraries in the US collaborated with local public health organizations to offer vaccination clinics at their rural branches. Public librarians are skilled at helping users find local information and the resources. In our 2015 study, the librarian participants emphasized the practice of verifying information before sharing it, because so much of what was being disseminated was contradictory. They make the best use of the knowledge and the skills they had learned in their MLIS programs for the provision of information services. They also clearly describe how they use a variety of channels and the formats to deliver critical information before, during, and after the disaster. Handouts and public announcements were printed and provided in the library. Social media sites such as Facebook, Twitter, and Instagram were used to disseminate information resources and to provide real-time services. Information professionals are lifelong learners, and they are quick to use a crisis to facilitate their own growth. From these quotes, we can see how library leaders apply the hard lessons learned to improve their services to their communities. The evidence shows us how well librarian first responders support building community capacity and resources for emergency response and recovery. Through our 3 studies, we have identified these top 6 tips for librarians regarding advocacy and community engagement. Caroline will provide examples of service models and other related evidence. As an educator, I wanted to say that librarians needed to believe that they are leaders. Librarians needed to believe in themselves and believe that they must take a leadership role in community advocacy and engagement and practice it in daily operations. You can do it. Yes, you can. As an information scientist and an educator, I recognize that librarians are among the first responders active in times of crisis. In these 3 studies, our teams have identified professional librarians require leadership qualification as well as the knowledge, skills, and competencies needed in the provision of community-first disaster information services. It is critical that LIS education programs enhance their curricula to cover the required qualification and the competencies we discussed. I now wanted to give the microphone to Caroline.
Thank you, Feili, and thank you, Health and Biosciences Library section at IFLA for inviting me to present today. My name is Caroline De Brún, and I'm going to talk with 2 hats on. In my main role, I am a knowledge and evidence specialist for the newly established United Kingdom Health Security Agency, into which Public Health England merged at the start of this month. Our main users include the public health workforce in England and policymakers. I'm also the evidence lead for the IFLA Evidence for Global and Disaster Health Special Interest Group, which works to promote and strengthen the roles that librarians play in times of disaster and in response to global health challenges, supporting Sustainable Development Goal number 3, which is to ensure healthy lives and promote well-being for all at all ages. For my part of this presentation, I thought I would follow on from Feili's top tips and provide some examples of how our knowledge and library services and the Evidence for Global and Disaster Health Special Interest Group have been supporting our users and other librarians to help decision makers provide an informed response to the pandemic. This photo was taken at the Evidence for Global and Disaster Health Special Interest Group satellite meeting in 2018, our first official meeting. It is a photo which fills me with pride as it shows a group of librarians from all around the world working together to improve the use of evidence and support our library colleagues in areas of crisis and conflict. Next slide, please. Thank you. So top tip number 1, building partnerships. For me, one of the big positives of this outbreak has been working more closely with librarians from outside our own knowledge and library service. I've been fortunate to do this anyway because of our work with IFLA, but the outbreak introduced new connections which have been so valuable to our work in terms of saving time and improving the quality of our searches through external peer review. It also helped me realize that I wasn't the only librarian who was struggling with the amount of information being produced. In March 2020, we were approached by Thomas Allen from the World Health Organization Library to become part of the Evidence Collaborative on COVID-19 network. This is an initiative which has 2 streams, one for researchers and one for librarians. The idea is to reduce duplication of effort in the production of rapid reviews and share search strategies and details of information sources, particularly those ones being specifically developed for COVID-19. Throughout this presentation, you'll see lots of links and we'll be sharing slides after this so you can have a look at some of these resources we're going to be talking about. The collaboration has representation from public health organizations across the world. And each month we join a call to share new developments and details of rapid reviews we are working on and reviews that we would like help with. Members include World Health Organization, Cochrane, McMaster University in Canada, UK Health Security Agency, University of Edinburgh in Scotland, Monash University in Australia, and others. This network enabled us to work more closely with the librarians at the World Health Organization and also the United States Centers for Disease Control and Prevention. They have been very responsive and we share search strategies, particularly on the specific variant terms, which change very regularly. And this saves us everyone time, but also ensures consistency in the COVID search terms that we all use. Working with this network, we were also introduced to the Librarian Reserve Corps, an inspirational network of librarians who support other librarians and information professionals responding to public health emergencies of international concern with an evidence base for their response. This group have been developing guidance on searching for evidence in times of crisis and have enabled librarians from other organizations, including ours, to contribute to the development of this much needed guidance. The National Institute for Health and Care Excellence, NICE, in the UK, have always been an important partnership for us, but more so during the pandemic. At the start of the outbreak, many new names were given to this new infection, including 2019 novel coronavirus, Wuhan coronavirus, 2019 nCoV, SARS-CoV-2, WNCoV, etc. And the official name of the infection was only agreed upon in February 2020 by the International Committee on Taxonomy of Viruses. We created a list of all the different terms and added them to our coronavirus website, which I'll talk more about later. The NICE information specialists used our list as a starting point when they developed their much more comprehensive and robust search strategies. They then shared their COVID search strategies with us, which meant that we had a trustworthy, validated search strategy to use in our own searches. And they continue to share their updates as the terminology changes and new subject headings are introduced. Preprints, which are research papers that have not been peer reviewed yet, have been a matter of concern for us because their methodologies have not been scrutinized yet. But many researchers were publishing on COVID-related topics as preprints so that they could be published more quickly. At first, we were hesitant about sharing them with our users, but we realized how important they are. So we share details of them, but with the caveat that they have not been peer reviewed. It has been really useful being able to speak with WHO, Librarian Reserve Corps, and NICE librarians to see how they deal with preprints. And we still meet regularly with the NICE team to share experiences of preprints and talk about new preprint sources and developments. We've also been working very closely with our National Health Service colleagues as we all support our local authority public health teams who are responding to the COVID-19 outbreak in our regions. They are able to provide local context and we can support each other at a local level. So the next top tip is communicating via multiple channels. I'm sure you've all noticed that using communication channels has been vital during the outbreak as we're all working remotely. And because our library colleagues are spread across international time zones and our users across the country, and we haven't been able to meet face to face, we've explored other ways of spreading our messages and delivering our services remotely. We've used Zoom and Microsoft Teams a lot for meetings, but also for delivering information skills training sessions, including database searching, using reference management software and critical appraisal skills. For promoting our services, we've used Yammer and Knowledge Hub, which is a digital platform for public service collaboration. Yammer is a little bit like Facebook, but for a particular organization. So they both enable us to share documents and news targeting particular groups. So on Knowledge Hub, there's, for me, there's a Southwest mental health group, there's a Southwest public health team. So I can target knowledge straight to them. We sometimes use Twitter, LinkedIn, and Facebook to promote events, such as forthcoming webinars. And one Facebook group that I find particularly useful is Libraries Step Up in Times of Crisis. I definitely recommend using it if you want to find out about information on webinars and general information on how libraries are working in crisis. For sharing knowledge, we use email discussion lists such as List Public Health, eHIL List, and IFLA List. We definitely feel that once there's so much to be learned, it's really important to share what you learn to save other people time. That's been one of the key messages we found. So top tip number 3, resources in multiple languages. One of the main aims of the IFLA Evidence for Global and Disaster Health is to make sure that content is available in languages other than English. As part of this, we have translated some of our content into Spanish, and we have held a Spanish language webinar where Gloria Perez Salmeron, IFLA's first and only Spanish-speaking president, held a conversation with the librarians from the World Health Organization about the fascinating work they do and its relevance to public health around the planet. Our Finding the Evidence for Global and Disaster Health leaflet is available in Spanish and English and lists information sources for high quality evidence and provides tips for searching databases. The majority of the resources that we share are freely available so that they can be used in any situation. In 2018, we held a webinar where we presented some of the information in this leaflet, and you can still access this video on the Evidence for Global and Disaster Health website, details of which I will share at the end of this presentation. We've also produced a leaflet which contains a list of tools in different languages to help people apply evidence-based practice methodologies, such as searching skills and critical appraisal. This leaflet includes details of content written in Spanish, French, German, Portuguese, Russian, Chinese, Japanese, Arabic, Hebrew, Italian, Turkish, and more. But if you think there's something missing, please take a look and do let me know, because we need everyone's experience in developing these materials. So, user-friendly training materials. In addition to our Finding the Evidence for Global and Disaster Health leaflets, we also created a website called Finding the Evidence for Coronavirus, which was created to signpost people to quality information sources about coronavirus and to help them search for the best evidence about COVID-19. Back in the 1990s, when I was starting out as a medical librarian, Professor Sir Muir Gray coined the phrase, knowledge is the enemy of disease. And 30 years later, it could not be more pertinent during this current COVID-19 outbreak, because without all the researchers sharing their knowledge, we would not be learning how to manage and contain this infection. However, back in January 2020, when news of the outbreak first broke, publishers wanted to make it as easy as possible for decision makers to access the best available evidence on coronavirus. And they freely opened access to all their coronavirus-related content so that there would be no barriers to evidence-informed decision-making in the management of the novel coronavirus. Personally, I found this all very overwhelming. Researchers rushed to publish their findings, and as they did, the volume of literature on coronavirus grew and grew, becoming difficult to manage and therefore find. A resource I found particularly helpful is the World Health Organization COVID-19 literature database, which is a fantastic resource, and I've watched it grow since its inception in March 2020. To date, it has collated almost 380,000 papers in a range of languages about the current outbreak. But that's an enormous amount of literature for decision makers to process, and it has been up to librarians to make sure our users get the evidence they need. As a comparison, I recently ran a search on the number of papers published on Ebola during the Ebola outbreak, and it was only 27,000 papers. So that is a huge difference. And we've been doing a great job in managing it all and making sure it gets to the right people. As I said, we wanted to make it as easy as possible for people to access and use all these resources. So in January 2020, we created this one-stop shop containing links to as much of this content as possible. These are the sections on the site, and we'll give you a tour later on in this presentation. Keeping up to date has been vital for our teams, and over the past couple of years, we have developed a suite of current awareness products, some just for our teams and others which are publicly available to everyone under the Keeping Up to Date section on the site. In January 2020, as we were first hearing about the outbreak in China, our National Incident Coordination Centre asked Knowledge and Library Services to pull together the latest evidence in the form of a daily alert, 7 days per week. It started off as just a PubMed search and tweets from international public health organizations. But as universities started producing more reports, we started including tweets from them too, in addition to articles from key journals before they get added to PubMed. We realized the value of this daily alert and offered it out to external users, and we now have more than 160 people subscribing to it. And I can tell you on an average day on PubMed, we have about 150 papers coming in, so the papers are still being produced. As the vaccine started to be developed, NHS librarians asked us to flag the latest research on vaccine development. So we added a vaccine section to the alert and our website, which includes papers publishing vaccine study results, consumer health information about vaccines in English and other languages, and resources to manage misinformation. A weekly digest is produced about the prevention and control of COVID-19 in home care and care home settings. And this is on the Keeping Up to Date section of the Finding the Evidence coronavirus page, alongside two other UK HSA produced resources which we host, namely the Literature Digest and the Behavioural Science Literature Report. The Literature Digest contains summaries of key papers about COVID-19 and serology and immunology, diagnostics, genomics, epidemiology and clinical, infection control, treatment, vaccine development, transmission, and modelling. Some of these topics are so challenging, being able to understand them. I feel it's been a very steep learning curve for librarians this year, learning all this terminology. As the outbreak evolved, other teams have requested regular alerts to inform their decision-making and outputs. These aren't on the website, as they're just to inform the work of the requesting teams, but they cover topics such as genomics, variants, co-infection and reinfection, and we happily share search strategies because we've spent a lot of time developing them and everyone's welcome to access them. We have also added a COVID-19 element to our existing current awareness updates, namely healthy aging, infection, mental health and musculoskeletal health, all of which are accessible on our current awareness page. The coronavirus website includes links to specialist evidence collections, guidelines, and our in-house rapid reviews. Our rapid reviews are freely available and cover a range of topics, including the role of face coverings in mitigating the transmission of SARS-CoV-2, COVID-19 transmission from the deceased, transmission of COVID-19 in school settings and interventions to reduce transmission, factors contributing to the transmission of COVID-19 within food manufacturing and processing settings, protecting the mental health of vulnerable people living in institutions following infectious disease outbreaks, the effectiveness of trauma-informed approaches to prevent adverse outcomes in mental health and well-being, and factors associated with COVID-19 in care homes and domiciliary care and the effectiveness of interventions. These are all available on our rapid review website, which you can link to from the coronavirus page, and are freely available if you want to use them and build on them. On our website, there's also a searching for the evidence section, which lists a range of COVID terms to help people build their own strategies. However, there are also tried and tested search strategies, which organisations such as NICE have created so that searchers don't need to start from scratch when searching for the evidence around COVID. We've also, there's also a link to the Health Education England living literature searches on COVID. So there's always space for you to go and have a look and find a search that's already been written. There's a list of COVID-19 databases, such as the WHO COVID-19 Global Literature on Coronavirus Disease Database, the COVID-End developed by McMaster University in Canada, LitCovid from the National Library of Medicine in the US, and the LOVE platform, which is part of Epistemonicus. It's important to communicate good quality information to the public, so we added a section containing information about COVID-19 for the public, and this includes trusted sources of consumer health information in a range of different languages and formats to ensure that everyone has access to good quality COVID-19 related information. So top tip number 5, better educate librarians for community engagement. In August 2019, members of the Evidence for Global and Disaster Health Specialist Interest Group delivered this webinar, where they discussed practical examples from across the globe of what library and information specialists are doing in the areas of advocacy, and in particular, how these examples can be modelled for advocacy of libraries' roles in disaster situations. Personally, I think this tip goes hand in hand with the final one of Feili's top tips about teaming up with other librarians, as professional partnerships make us stronger and help us deliver more effective services. So, part of my thesis was about the importance of librarians learning from other sectors and working together. Libraries and librarians are a core asset during pandemics because they already have the resources, skills, and processes in place to manage the avalanche of COVID-related information that has been published over the last couple of years. Medical librarians are highly skilled in performing health-related literature searches and delivering searching and critical appraisal skills training to health professionals. Public librarians have access to the target group, the public, understanding the needs of their communities and owning their trust because they are known to them. Research has shown that people would like assistance in finding quality health information from their public libraries. Health information literacy is an area where all libraries can lead on, whether medical, public, or academic. Creating health information literacy support programs and resources is an important area for medical, public, and academic libraries to work and lead on together. And this would be of benefit in terms of professional development and more efficient working practices. By sharing resources and skills, libraries can operate more effectively and demonstrate greater value to their users and stakeholders and provide a vital service to their local communities. Often based in local authorities, public librarians are in an ideal place to work with local public health teams, policy makers, and community dwellers. Before the pandemic, our Knowledge and Library Service was working with public librarians and Health Education England to deliver health information literacy workshops to the public, showing them how to identify good quality research and appraise it to help them make informed decisions. This hasn't been something that we've been able to do so recently, but once the crisis situation has calmed down a bit, I think it would be beneficial to develop a suite of resources for public libraries to have access to during future pandemics, although I hope we won't have to have any more for a long time. In hindsight, we could have circulated lists of consumer health information in other languages to public library networks, although we did circulate details of the coronavirus website to our local authority public health teams, so hopefully it will have filtered across to public libraries. We share experiences with our public health and NHS librarian colleagues via email discussion lists, but perhaps we could have also shared them via public library networks. There are other ways in which we can work together cross-sector, and health education England has created a really useful page which provides suggestions for working with public libraries. Ideas include librarian exchange, job shadowing, visits, joint training with public library staff, and arranging a procedure for referral of more complex queries. I think that when we have a chance, it would be great to get together again and have a brainstorming session or an after-action review to work out how we can better support each other, both professionally and personally, particularly with regards to health and well-being. Librarians play a major role in supporting communities, not just in times of crisis, but throughout the lifetimes of their populations. People don't appreciate how stressful this pandemic has been for librarians and information professionals. As Feili emphasised earlier, librarians are not only fighting the pandemic, but also as infodemiologists, we are fighting the infodemic. So the next slide. If you're interested, we'd really like you to follow our work. And you can follow us via Twitter, the website, and a newsletter which you can sign up to. On the website, Bailey, is it possible to have a look at the website for the E4GDH group? Bailey's been fantastic managing all of this. Also, that's the Finding the Evidence Coronavirus. Can we go to the other tab for the evidence for global and disaster health, please? Thank you. So yes, so on this website, you can read our news, details about our events, and access the leaflets we have produced. There is an evidence briefing available about the role of librarians in times of crisis, although this needs updating. Following Feili's publications and the pandemic, as we have proved how much more we can do since the briefing was originally published just before the SIG was launched. The Evidence for Global and Disaster Health is a very interesting and necessary group to belong to. If you would like to be involved, please get in touch. We're really happy to have your feedback, comments, suggestions, and input to the future development. So thank you for listening. I think we have some time for questions. So I'm going to hand back to Bethany, I think.
Thank you. Yes, thank you, Feili and Caroline, for that wonderful talk. Very interesting. We have one question in the Q&A. So if you have more questions, please type them into the Q&A. You can also raise your hand and I can unmute you if you want to sort of speak your question. So let's go with the Q&A questions first, and then if people raise their hands, I will call on them accordingly. Do you think the way in which medical librarians have responded to the pandemic have raised the profile of the profession in healthcare settings? So I suppose that can be for either Feili or Caroline or both of you.
Well, I'm happy to have a go at responding. Thank you, Luca. Yes, I do think, I know definitely within our organisation, we have just not stopped since the pandemic started. It's been, yes, full on, nothing but COVID. We've been asked to do literature search training. We had so many literature searches on COVID, and it's. I think we have our level of inquiries has definitely increased. I think because they've been making all the decisions, particularly in the UK, they've been making decisions about based on the science, they keep on saying, and it's emphasized the importance of evidence in practice and the importance of applying evidence into practice. And we've had, yes, our policymakers and our heads of department have all been asking us to respond to find the evidence to support the various questions that are arising as the pandemic has evolved. Feili, do you have anything more?
Yes, and I also think so too. It's very interesting. There's one example that and a group of doctors are willing to work with public libraries to develop videos to explain the facts about COVID-19 and also about vaccines. So I think it doesn't matter how we feel about the current pandemic, but this pandemic and also have already brought us together, particularly brought the health professional, public health professionals and information professionals all together. That's my thought.
Okay, there's another question from Emma. Librarians as first responders is a powerful image. How can we encourage and equip more librarians to take the lead at times of crisis?
I think, first of all, and as I said earlier, and I really think that librarians needed to believe in themselves first. They are so well trained. They have knowledge, skills, they have personal skills, wonderful personal skills, can work with their local populations so well. They are well familiar with their local communities or the communities they serve. And I think librarians needed to advocate for themselves first, really show their image and really promote their services and brag about their services. That's how I think about it. Of course, after so many studies that our teams have conducted, we step by step have already integrated our findings in the curriculum development in our school. And I really hope that our work can help well-equipped, can better equip students with knowledge and skills to help their to help their users and to advocate for themselves. That's how I feel about it. Caroline?
For me,
Caroline?
I think that libraries, they're such a neutral place. People can feel safe. Librarians are neutral. They don't have any other agendas. So, and
Right.
everybody knows them. So, you know, they're trusted, they're unbiased. People, they know everyone, they can connect people with each other. They're in such a strong position. And I would like to have an additional, some way, an event that we can come together after the pandemic and see how we can encourage and equip more librarians to take the lead at times of crisis, or maybe just to get people to showcase what they've done. And because I think we've all achieved so much in the past couple of years, but I hadn't, until working with Feili, I hadn't really appreciated just how great librarians are, really. I'd like to do some proper work on building a suite of tools, on how we can support each other, find out what's needed, actually, to do a needs assessment, what librarians have needed, what they've been through, do a proper assessment following the pandemic, to prepare for future pandemics and other disasters. And I hope these things don't happen, but they do. And even if it's just something in a community, just affecting one community, to have some resources available to help them, to help libraries promote themselves would be really great. And I'd love to be involved in developing that.
Okay, there is one other question in the chat. You mentioned leadership qualities as vital to the toolbox of an information professional. How do we embed more leadership training opportunities to really hone these skills? And how do we help people identify opportunities for exercising leadership?
So I can answer these questions for certain degree, and I will let Caroline to follow more her comments. I really think that we needed to integrate the leadership qualifications in the LIS education program. Get our students understand before they become information professionals. Let them understand that librarians can be leaders, and also help them understand that these qualifications should be operate in daily basis at work, and also help them understand the importance of emotional intelligence at work. That's how I feel about this LIS education program. Then LIS education program needed to work with local, regional, and national libraries to develop professional development program. Okay, keep on training librarians. After they finish their education program, it doesn't mean that they should stop learning. So we needed to integrate these qualifications in the professional education programs. That's one thing. And also, we needed to better understand the situation in the field and also encourage libraries to promote professional education trainings for their staff members. And I think staff training is very, very important. We needed to better help librarians and library school students understand that they all can become leaders. Their self-initiatives, their creativities can help them shine. I think that's the most important thing. If they don't believe themselves, none of these would happen. I'll be honest. I have been in this business for years, and I have already seen a lot of students who are so full of confidence. And after they graduate, they will develop a wonderful career. So those are the qualities that we need to help our library school students understand and also help librarians understand. So Caroline, any comments?
Well, just very quickly, because I can see we're running out of time, but for me, I think it's important to bring out people's personal characteristics, help them identify their strengths. When I think of leadership, I do think of budget management and staff management, but there's also very much the personal side of things. Some people are very much stronger in those things, and it's drawing those out that I would like to see done. And that might, yes, on a course, on an academic course, but also, as you say, after you've graduated, when you're in your workplace, seeing initiatives to draw out people's qualities and encourage them.
Great, thank you both. That is all of our questions, and it looks
There's
like
another one in the chat, or is that a nice comment?
I think that's a nice comment.
Nice comment. Thank you.
Yeah.
Okay.
Thank you.
Thank you.
So yeah, perfect timing. We are going to go ahead and wrap up. Thank you to all of our presenters, to our panelists, and to the attendees. The recording will be available, so look for that coming up shortly. Thank you all.
Thank you.
Thank you
very much.
all for
Bye.
joining us today. Thank you.
Bye.
Thank you.
Bye.